Hi everyone, welcome back to my channel. So today I wanted to talk about RFK Jr. and also give a little spiel about conspiracy theories and how I feel about them and where I stand. These two subjects are closely related. But the reason I want to talk about RFK Jr. is because he has been nominated to head the Department of Health and Human Services. And if you are disabled here in the United States, if you are on full disability, you're likely also on Medicare, and that is your insurance, your medical insurance. And so the Department of Health and Human Services oversees Medicare and Medicaid. And so I'm going to talk a little bit more about that. So this nomination could directly affect those of us who are disabled and chronically ill. He does have a history of being anti-vaccine and indulging in weird conspiracy theories. One of the weirdest ones being that COVID spared Jewish people and the Chinese, which I'm pretty sure is false because it started in China and I'm pretty sure a lot of people in China died. So that's kind of a strange conspiracy theory. But he also believes that gender dysphoria is caused by chemicals in water. I don't know much about that conspiracy theory, but I guess it's something that he has, that he's discussed. The other thing, I have heard that he is also on board with the Lyme disease conspiracy theories. For example, it's basically the same thing as COVID. Lyme disease, the conspiracy theory behind that is that Lyme disease was developed as a bioweapon in a lab off of the east coast of the U.S. And it was being developed as a bioweapon and it escaped from the lab. Sound familiar? And it spread, and that's how we now have this sort of epidemic of Lyme disease in the United States. That, again, it's the same conspiracy theory as COVID, so I would be very skeptical to believe something like that, especially when it's just seems to be recycled and applied to another pandemic, I guess. Here's where there is cause for concern. So I've been watching bits and pieces of the nomination process, the hearings, and RFK Jr. makes money off of litigation against vaccine companies. I'm not exactly sure what he does. I don't know if he recruits people that are looking to sue vaccine manufacturers, or if they just come to him, if he's got some kind of a business or something that helps them with these lawsuits. But he helps with the litigation, and then if the person wins their case against these vaccine manufacturers, he gets like a 10% cut of whatever they win. So he is actively making money by suing vaccine manufacturers. So that is a bit concerning, especially if you're going to be the head of Health and Human Services, right? Does he have some good ideas? Yes, he has some good ideas. He wants to remove certain chemicals and food colorings from food. But again, his basis and his rationale for this is that certain food colorings cause like ADHD or certain learning disabilities in kids. Again, there's no concrete evidence of that. I mean, it's not going to hurt to remove these chemicals, right? It's not. I find this is a relatively harmless thing to do. But again, if it's based on some kind of weird conspiracy theory or some unfounded, information that that he found somewhere, it's not making a case for him. Where this also can affect a lot of those of us that are, dependent on, Medicare and Medicaid is that he lacks some very basic knowledge of those programs. I think they had asked him like what the difference was between Medicare and Medicaid, or like what those programs were, something like that. They asked him some question about these programs and he just did not know how to answer the question. That is concerning because he's going to be overseeing those programs, and those programs directly affect millions of Americans, specifically disabled Americans, low income Americans. And there's a crossover between disabled and low income Americans that receive both Medicare and Medicaid. So that gave me pause because I receive both Medicare and Medicaid, and to have somebody that has no clue what those programs are, being in charge of those programs is a little bit concerning for me. Here's where I stand when it comes to, vaccines and stuff, and I just kind of want to give my thoughts on this. I'm pretty sure I've discussed this in some of my other videos. I did not get the COVID vaccine. You probably already know this if you've been watching my videos from, for a while. I did not get the COVID vaccine. But I also have pre-existing health issues. I'm not sure exactly what they are, but I know that I'm very sensitive to everything. I'm sensitive to foods. I'm sensitive to skincare items. And I'm pretty sure anything that goes in my body, there is a potential for some type of reaction. And so I decided to be extra cautious and not get the COVID vaccine. Not that I think that it's going to do anything, that it's some kind of nefarious vaccine. Everybody in my family got it. I made sure that everybody in my family got the vaccine because then that would add protection to me because I'm in contact with them. And they're all fine. They've gotten their vaccine, their original vaccine, and their boosters, and they have been fine. So here's the thing. I do believe that vaccines can cause some unwanted effects, sometimes maybe a little bit more long term. I don't think it's the vaccine itself. Because if it were, for example, let's take autism. If vaccines cause autism, so many of us would have autism, right? Everybody would have autism. If there was a direct correlation between a vaccine and having autism, everybody that would be vaccinated would have autism. And we're not seeing that. Granted, it's being diagnosed more and more because we have more knowledge of the condition and we have actual criteria to diagnose it, as opposed to, 50 years ago where there were still autistic people. We just, people would just say, oh, he's kind of slow, or there wasn't an actual name for it. Now we have, criteria, diagnostic criteria, and more people are getting diagnosed with it. It's not that there's more autistic people, it's just better diagnosis. Now, let's just say, because there have been parents that swear that vaccines cause autism, that as soon as their kid got vaccinated, that they started noticing these weird, behaviors or something different about their kid. Again, it's a minority of children, or else we would have just 100% or close to 100% autistic kids in school. But I think what it comes down to is possibly genetics or a pre-existing condition. Now, I had a couple of people in my family that developed some kind of issue after the COVID vaccine. So I had one cousin that developed like body pain, I guess like a fibromyalgia type body pain after she got the COVID vaccine. And I think I had an uncle that also developed something similar, like fatigue or something after getting the COVID vaccine. They both have pre-existing conditions. My cousin's diabetic. My uncle has chronic health issues stemming from, cancer and radiation therapy many, many years ago. So I do think that some of us may be more susceptible due to having pre-existing conditions, or some of us just are we have something genetic that has not been identified that could make us more vulnerable to developing complications. It's still the vast minority of people because we have not seen any widespread disability coming from the COVID vaccine. So I'm not discouraging people from getting the vaccine. I'm not a doctor. This is just my own opinion on it. But I think what people get upset about, and this is true of any chronic condition, whether it's Lyme disease, ME/CFS, autism, is that doctors refuse to listen, and doctors refuse to even entertain the fact that, a vaccine or, a medication could have caused such long-term issues. For example, fluoroquinolone antibiotics, and I did a video on this, have been known to cause tendinitis and tendon issues. but is a growing group of people that say that it causes much more far-reaching issues like fatigue, neurological problems, leg pain, and just all this whole slew of issues. And then doctors don't want, they're just like, no, it's not that. It's all in your head, even though it has been shown, that fluoroquinolones, they even have a black box warning on them. So I think that's the issue, is that people are upset that doctors don't believe them. So they come up with their own conspiracy theories. And, like I said, I don't buy into them. I think the Lyme disease conspiracy theory is the same as the COVID one. So how does everything have the same conspiracy theory, right? Everything leaked from a lab. But I think it's a way that people cope with their suffering. And I've gone to support groups for chronic illness, and conspiracy theories always come up. And I just think it's a way that people cope with their suffering. It's unproductive, in my opinion. Now we're seeing that it could be dangerous, especially when you have someone like RFK Jr. that is just, he believes every single conspiracy theory out there. And now he's going to be the head of the Department of Health and Human Services. So that can, we'll see what happens. He hasn't cleared the whole nomination process yet, but, when you're not dealing in science, it can be dangerous, especially for those of us who are very vulnerable, who have chronic illness and can, an illness can be life-threatening. A basic illness like a cold or a flu can possibly be life-threatening. Let me give you an example. There are people that are not vaccinating their kids anymore. As of right now, I think you have to get an exemption, some kind of, I think it's like a religious exemption or some type of health related exemption in order for your kid to go to school without their vaccinations. Other than that, your kid has to be vaccinated before going to school. There are doctor's offices. I have gone into a doctor's office, I think where my primary care doctor practices, they will have signs in the waiting room that say, if your child, or if you don't want to vaccinate your child, we cannot take your child on as a patient, something like that. There's a sign that says, if you're not going to vaccinate your child, we will not be your child's doctor, because I think it's a family medicine practice. And so I think with RFK's nomination, what may happen, this is my prediction, if he makes it through, is that he's not going to eliminate vaccines. Because I think people are taking things to a bit of an extreme, and they're saying that he's going to ban vaccinations. I don't think that that's going to happen. What I do think may happen is that he will make them optional for children to go to school. So they're not going to, because you have to have your vaccines before school. They won't allow you to enroll your kid in public school, if they're unvaccinated, because it's a health risk, right? It can cause a serious problem. I think what he may do is just make it optional, so that parents can enroll their kid in school without the kid being vaccinated. That will likely, for people that would have been forced to vaccinate their kids, because they didn't have an exemption, they couldn't get an exemption, it's going to sort of open the floodgates for people to just stop vaccinating their kids. There's still people that are going to vaccinate their children no matter what, but I definitely think it's going to make it much easier for people that are maybe on the fence to just say no. And now, how does this affect us, those of us that are chronically ill and that are more vulnerable? Well, let me tell you what happened, something that I saw in my blood work recently. So all of us, probably of my generation, I'm 40 years old, we all have our measles, mumps, rubella vaccine. We have all our vaccinations. There's that other one, tetanus, and so on and so forth. Well, these vaccines don't last forever. They can last a long time, but once you get to be, once you get to middle age, then your vaccines start to wear off. I recently had an appointment with an immunologist, and he actually decided to test. I'm not really sure why he did this, but I'm glad that he did. I had already been told by my primary care that I was due for my tetanus, that I needed to get my tetanus updated. But again, I'm worried about the way that my body would respond to something like that, because my body just has a way of responding, in a very exaggerated manner to everything. But this immunologist ran all of my, I guess, my antibodies for the vaccines that I've had. So he did tetanus, and he did measles, mumps, rubella. And my mumps is actually the one that I'm losing immunity to. And keep in mind, that's a childhood vaccine, and that's one of the vaccines that has gotten a lot of controversy when it comes to autism, and it's a childhood vaccine. That's the first one that parents are going to opt out of if they're given the choice. And those of us that haven't been vaccinated since childhood, and that may not be able to get vaccinated again due to health issues, we're now going to be walking around without this protection, with an increasing number of parents that are not going to vaccinate their children. I don't have children, but my sister has kids, my brother has kids, and so their kids are vaccinated, but I also live in a building with children, so you just don't know, right? So I actually discussed this with an infectious disease doctor. And I showed him the blood work, and I said, is this something that I should be concerned about? Because my mumps looks pretty low, and and he said, I wouldn't be too concerned about that one. If it was measles, I'd be much more concerned, because I think measles is starting to circulate again. And that's one of the vaccinations that people are opting out of for their kids. So again, this is just, this is my opinion with this. I don't want to get too political with it. Do I think that RFK has malicious intent? No, I don't think that he's going to go in there and do something evil or nefarious. I really do think he believes these conspiracy theories, though. I think he believes, he genuinely believes these things, and he probably would feel like he's doing the public, a great service by allowing vaccines to be optional. I don't think he's going to go in there and just say, well, people can no longer get vaccinated. People can no longer have access to medications or this and that. I just think that it's about freedom. And so he's going to make it optional so that children aren't forced to get vaccines just to go to school. Those are my 2 cents. I'm not a conspiracy theory person. There's a lot of people in the chronic illness community that are. And I know there's a lot of people in the chronic illness community that, for whatever reason, are very excited about RFK Jr. Being nominated for this position, without really thinking of the consequences that it could have for those of us that are vulnerable. So that's just how I feel. It's not even really political to me. It's just common sense and public safety. We already saw how bad that could get during COVID, when our country is not prepared for a disaster like that, for an infectious disease disaster. And making vaccines optional can lead to another infectious disease disaster in this country. So that's what I've got to say about that. Please like and subscribe, and I will see you in the next one. Take care.